Hi everyone, my name is Melanie Manuel, and for my family theory presentation, I will be presenting you the Calgary Family Assessment Model developed by Wright and Leahy. The Calgary Family Assessment Model, CFAM, and its companion model, the Calgary Family Intervention Model, also known as CFIM, is described as a comprehensive and multidimensional family nursing assessment model that identifies strengths, weaknesses, and resources within a family. It's a thorough and detailed evaluation of a family and its relation to a larger context. And this assessment determines the need for intervention for nurses. However, it's not always indicated. The ultimate goal using this model is to guide the family to optimal family functioning. There are three components in CFAM that guide the assessment of a patient and their family. The three components are structural, developmental, and functional. It is not necessary to assess all categories of a family, as nursing interventions can be narrowed down using a specific category. I have a picture to your right that gives a brief description for each component. For the structural aspect of the Calgary assessment, pretty much defines who is in the family. It has three subcategories: internal, which is comprised of family composition, gender, and sexual orientation. The external subcategory is comprised of the extended family, and context is comprised of ethnicity, race, and social class. Important tools for a structural assessment is the genogram and an ecomap. The genogram defines internal and external family structure, and the ecomap outlines family and relationships with the outside world. I have an example to your left where the inside circle is the genogram, which shows the family composition, and the outside is the ecomap, which shows helpful and tense connections with other family members. Using these tools allow the healthcare provider a visual of who is involved in the family and how each are related to each other in either a positive or negative manner. This is the start to assessing the family. Although there are various meanings to what family means, Wright and Leahy define family is who they say they are. The second category is the developmental assessment, which helps us understand developmental life cycle for each family. Assessing the appropriate stage allows the healthcare provider perspective on the current environment the family is experiencing. When assessing the family, we would determine which stage they are in the middle-class North American family life cycle. Specific tasks need to be accomplished within each stage, and so we would assess to see if the family is completing each task. For example, for the first stage, launching of a single young adult, there are specific tasks that need to be completed within that stage. For example, they would need to assume new responsibilities and a new role as they move out of their family household. The last category is the functional assessment, which assesses how individuals in the family behave in correspondence with one another. It enables assessment of the physical, emotional, and spiritual health of the family. And Wright and Leahy define this as the heart of the family assessment. It is comprised of two subcategories, instrumental and expressive. Instrumental is described as routine activities of daily living, which consists of eating, sleeping, preparing meals, or taking medications. And the latter is expressive, which is more communication, emotional, verbal, nonverbal, problem solving, roles, beliefs, alliances, and coalition. For the Calgary Family Intervention Model, There are three key model concepts. The first one is supporting the cognitive domain of family functioning, which consists on providing resources and knowledge, praising strengths and support of the family, and working together with the family to identify solutions to obstacles. The second is supporting behavioral functioning during developmental stages. This is where you incorporate multiple family members' perspectives with upcoming adjustments in life, and just to continue to applaud positive family functioning. The third is supporting effective domain of family functioning. This is where you validate family members' feelings of concern and gather and increase more family support. After description of the Calgary Family Assessment Model and discovering the key model concepts, nursing can be defined as providing holistic interventions after detailed analysis of the structural, developmental, and functional elements of a family to ascertain favorable family functioning. So how is the assessment model applied to family nursing practice? It is globally accepted and recognized as one of the 4 leading family assessment models in the world and has widespread application into the clinical setting and the educational setting. One of the most popular aspects of the model is the 15-minute family interview, and another is the use of the genogram and EGA map. The family interview permits increased knowledge and analyzation of the family, new intervention implementation, and empowers the nurse-family relationship. There was a study done that used the CFAM in non-traditional family units, and it identified strong positive as well as negative relationship bonds, which provided nurses a strategy and approach to guiding diversified family arrangements. There have been multiple research projects guided by CFAM and CFIM, most notably in mental health. The first aim of the first project was to analyze families living with young adults with mental illness and their experience with family-centered support conversations. The FCSC was based on the theoretical grounds of the CFAM and CFIM. After therapeutic conversation, family members felt more emotional and cognitive support. It increased caregivers' emotional and cognitive support and functioning, illness beliefs, and caregiver responsibilities. And families with young people encountered old and new connections with family members, thereby extending the family network. The second aim of the next study evaluated the effectiveness of therapeutic conversation in an acute inpatient psychiatry with families. The therapeutic conversation was also based on the CFAM and CFIM, and family members also perceived increased cognitive and emotional support from the nurses versus just receiving standard care. The next research project's aim wanted to evaluate effectiveness of therapeutic conversation in group and caregiver sessions of people with eating disorders. The intervention was focused on caregivers and working on difficult behaviors, feelings, and helpful strategies. Conversations proved to be beneficial where caregivers saw a difference in emotional and cognitive support, illness beliefs, strain of caregiving responsibilities, and patient behavioral difficulties. It showed improvements on how healthcare providers can support primary caregivers in their supporting role. The next research project's aim wanted to determine the effectiveness of family-based interventions and the prevention of stroke recurrency. This utilized the CFAM-CFIM model to assess the function and behaviors of family and developing therapeutic relationships among patients' families and the respective healthcare provider. Determines the effective family and lifestyle behaviors that potentially contribute to recurrent strokes. But unfortunately, due to complex health promotion issues, managing these lifestyle risk factors is intricate. This article showed that there is a lack of research on family-centered approaches to lifestyle change on the affected individual. In conclusion, employing the CFAM or CFIM into nursing practice imparts significant knowledge and insight into the family to guide nursing actions to promote, improve, or sustain family functioning. It increases strength and resiliency of the family. The assessment model can be broad or specific towards a particular issue the family needs to address, and it guides actions through health promotion or during times of illness. For my family assessment assignment, I want to practice the CFAM-CFIM model and implement this tool on my designated family to determine the need for nursing intervention. I want to provide therapeutic communication to strengthen family bonds to either promote healing and reduce suffering if possible. That concludes my presentation. I hope you guys enjoy, and I hope you guys have a wonderful day. Thank you.